Hi guys, my name is Ray.
And my name's Austin.
And we are currently third year DO students at Western University, and we're rotating with Dr. Ben-Zur at the moment. So pretty much making this video just to give you guys an idea of what to expect on your rotation here with Dr. Ben-Zur. And just typically, as a run through what goes on, usually we start, each day that we come in, we start at 6 a.m. And it's a pretty long day. It usually goes until about 6 p.m. or a little bit earlier, a little bit later, depending on how much work you have to do and how many patients we have to see. Typically on Wednesdays, we have our procedure days. So we go with Dr. Ben-Zur over to Tarzana Hospital and watch him do a whole slew of different procedures, such as CATs, ablations, and so forth. When you guys come and rotate, it is 6 days a week. So we go from Sunday to Friday. With Wednesdays being our procedure days. And each day it is from 6 a.m. to about 6 p.m. And typically what happens is when we come in the morning, usually we come in about 10 to 15 minutes early, so about 5:45 to 5:50, we kind of prepare ourselves to see patients. And usually the bulk of the patients come in the morning, so that's when we get pretty busy seeing patients and presenting, that Austin will talk to you guys about in a little bit. All the patients usually in the morning. Depending on how busy the day is, if it's a very large patient load sometimes, so if it's an easy day, maybe we'll see about 40 patients. If it's a very busy day, maybe we'll see about 60 patients. Again, it varies from day to day. Sometimes our last patient we may finish at about 2:30 or 3 o'clock, and sometimes 4 o'clock, or sometimes a little bit later. And usually after all the patients come in, we see them, we present it, we write our notes, then we have about an hour or so of lecture time. And this is when Dr. Ben-Zur brings in different types, lecturers to lecture on different topics, such as hypertension, renal disease, surgery, and so forth. A lot of questions that students rotating may have involve like parking, for example, some of the logistics stuff. So parking here, there are a couple streets like on Garden Grove as well as Lindley, I think. The two streets that are right next to the office, they are free parking. So we can park there pretty much in the morning all day until night, and it's fine. We also get a lot of questions about, let's say, food and lunch. We don't have a dedicated lunch hour per se. But if you guys need to step out for a little bit to grab some food, there is a kitchen in the house next door where you can store your lunch and you can eat the food that you bring as well. Otherwise, we have some really nice staff here, like Leora, who for all the students, she makes sandwiches and different types of lunch and brings it to us for us to eat. So that's really nice of her. And usually for me, that's the lunch that I eat. And then I have a lot of snacks that I put in my pocket, and I'll eat that throughout the day. If you guys are worried about housing, for example, you definitely should contact Dr. Ben-Zur or whoever the contact is that you have. Typically, it's Elizabeth, and let her know immediately that you need housing as soon as possible. And she'll be able to work out some housing options for you. Again, that kind of varies from person to person.
Now I'm going to talk about the patient encounter and patient presentations, and how to conduct those properly, what's expected from you from Dr. Ben-Zur, and also how to prepare for them properly. So I'll start off with how to prepare for them. So basically, Dr. Ben-Zur will say, okay, Austin, can you see Mr. Blank in room blank? So what I'll do is I'll write down the name and the room number, just because initially I thought, okay, I could remember it and look at the chart, but you end up asking him and he sometimes gets annoyed, so just make sure you write it down. He tells it to you once, makes everyone's life easy. So that's one thing that I've learned to do. And now, so once I know who I'm going to see, I'll go into the EMR on the computer, which you'll definitely learn a lot more of that once you're here at the clinic on your first day. So I'll look up the patient and review their chart. And how we do this is basically you'll look at the HPI and see first what their past medical history is. And that's actually a very important thing that I'll get into a little bit later. but you want to see where they've had an MI in the past, stents placed in the past, possibly a CABG or any surgical procedures, all cardiac related. It's always the first line of the HPI. So I usually will write that down, and then you'll go into what they came in for their last visit. Maybe it was just a feeling of shortness of breath, palpitations, or sometimes you'll just see the patient frequently presents for an INR check or for blood pressure check. So I'll write down a little note on their last visit, and then you'll go down to their medications. That's usually the next aspect of their chart. And I'll go through each medication and just make sure I know what it's for, why they're taking that medication, maybe an adverse effect, and just be familiar with that, because I've been asked sometimes in the encounter by the patient, what's that medication I'm taking for again? Or might ask, is this an adverse effect? They sometimes have questions about the medications themselves, or are unsure why they're taking it, which it's always really nice if you can answer that for them. Initially, I was unprepared in that sense, and it didn't feel right when I couldn't, offer them some words of advice or help them in that way. So if you could prepare yourself for that beforehand, it would definitely help a lot. And so yeah, HPI, medications, and then regarding the ROS and physical exam, usually I just look at the ROS and the positive findings will show up in red. So I usually will just write down what they were positive for last time. And regarding the physical exam and stuff like that, I think you do too, right? You kind of just skim over that straight to the plan. Because you just want to get a brief summary of the patient and know what you're going into. You don't need to memorize every little fact for two reasons. One, you're going to have actually the computer with you. So if you need to, you bring a laptop into every room. So yeah, if you need to access it, you can always just refer to that. So you don't need to memorize every medication, but you want to be able to just glance at it maybe once or twice and not be reading it in front of the patient. So yeah, just the ROS, you can just remember the things. Okay, he had back pain, or he had some numbness and tingling, some palpitations, once again, stuff like that. And then skip down the plan and see, on the last visit, what they plan to do for this patient. Maybe it was make sure they're on a healthy diet or exercise, which is something you will see on every single chart. And yeah, just be familiar with that. So then you'll go see the patient, and how I usually start, you always introduce yourself and just introduce yourself with your name. Saying I'm a student doctor blank is actually advised against, because Dr. Ben-Zur has found that some patients can be turned off immediately when they hear they're being seen by a student doctor or a medical student, which was actually surprising, because we go through first 2 years of our training being told always, and make sure you always do it by introducing yourself as student doctor, because you don't want to fool them otherwise. But here you just want to be very warm and nice, and introduce yourself with your name. Hi, I'm Austin. We'll be seeing you today. How are you doing? And just introduce yourself like that. But then other than that, you always want to ask there for their preferred name and stuff that we back on track to things that we've always been taught. And after that, you're going to ask, so what did you come in here for today? And then follow on naturally with their response. And going from there, if it's, let's say, most commonly, like I said, a follow-up exam, you'll ask them about their symptoms that they presented with previously, and ask if it's improved or gotten worse, and if anything's changed since their last exam. A big portion of it, though, will be medications, and making sure you don't just say, so have you been compliant with your medications? That doesn't cut it, because a lot of times I've found patients say, oh yeah, I've been fine with that. And then once you start to ask, okay, so you're taking Plavix, 15 milligrams 3 times a day. Oh no, I've been taking it once a day, and they've been taking it wrong, and they haven't even known it. So you have to make sure you go through each medication and ask them have they been taking it as prescribed? That's definitely a big thing that I made a mistake initially by not doing that, and I realized Dr. Ben-Zur said you should double check, and I found out that the patient was unfortunately not taking their medications as prescribed. So sometimes patients, they'll fight it. They'll say, "Oh no, I just did this. I know I don't need to go through each one," because they don't want to take the time. But it's very quick. You just read it off, and it will save you definitely, and save the patient. So that's definitely a big tip. And then next, after the medications. Regarding the physical exam, and usually I'll listen to the patient's heart, just being at the Cardiovascular Institute, I feel it's appropriate. But other than that, not much physical exam is performed. I performed maybe 3 neuro exams because patients presented with some dizziness or said their arm was tingling, and so it was only appropriate in those cases. But typically, you don't have to do, heart. I mean, heart I tend to do, but lungs and, MSK and all those things, it's not expected here. The main thing is medications, and then the next thing I'm getting to is patient education. That is so huge with diet and exercise with every patient, because every patient here pretty much has a past medical history of hypertension, hyperlipidemia, had MI in the past,
Richard, if you don't mind,
palpitations. So it's so crucial to deeply discuss these issues with the patients and why it's so important to maintain a healthy diet and exercise. And specifically, Dr. Ben-Zur's an avid believer in the vegetarian, all-vegetable diet. So that's what we've been taught to teach our patients. So, yes, did you have anything to add, by the way, on any of this?
I do want to add that for the physical exam, mostly you do want to focus on the heart. And in many cases, because of all the different pathologies that you'll see, you'll listen to some very interesting things like heart murmurs or valve replacements and things like that. I do have to say, though, that if a patient comes in and does present with a certain system that may have like an infection or pain or whatever, you should definitely look at that. Listen to the heart, do a cardiac exam, a quick cardiac exam, but also look at that other aspect as well. Like if they come in presenting with dysuria, then you should maybe do a very quick general urinary exam, like look feeling for CVA tenderness, if there's any cystitis, abdominal pain, things like that.
I totally agree. Thank you for bringing that up. For example, a patient presented yesterday actually with URI, and we think she had bronchitis. And so, we did a quick heat exam. Just wanted to check the ears, check for any, signs of infection, check the head, eyes, ears, nose, throat, check the oropharynx. So there are cases, always, base your physical exam and what you do on physical findings, rather than, sometimes you just got in that robotic mode of just doing all these physical exams. Here it's really based on patient complaints. Would you agree in that sense? Yes, what they come in to present with. So really pay attention to those things. But other than that, the patients are all very nice and very thankful for everything we do here. That's definitely something I learned from day one. And it is a great place to be. So you'll definitely meet some interesting people. It's a good time. So once you feel you've adequately questioned the patient and extracted all necessary information, once again, just to recap, just HPI, you're going to focus on, because it's usually a follow-up exam, what they've done since their last exam, any changes in symptoms, anything get better or worse, and then question further from there based on their response. Medications, big important fact, to question them on their medications, go through each one, making sure you do that. And then physical exam based on what the patient reports on how they're feeling that day and things along those lines. And then the education component. with diet and exercise. So once you feel that you've adequately conducted your patient encounter, you will then present. And what's expected for you is to first start off by stating the patient's name, of course, age, sex, and then the past medical history. So for example, let's say I saw Steve Smith. I'd say Steve Smith is a 40-year-old male who presents with a past medical history of hypertension, hyperlipidemia, MI ×3, where he's had a stent placement in 2013. So that's something that is definitely new for us, because usually you're used to presenting the chief complaint first. But since a lot of times it's a patient for an INR check or follow-up exam like I've been mentioning, you just want to focus on the patient's name, age, sex, and then the past medical history. So from there, you will then go into their cardiac complaints that day, stating, for example, that patient complains of palpitation that started last night at about 9 o'clock. They have been consistent till this morning, no associated symptoms. And then from there, you can go into the medications. And you would mention patient has made no medication changes since the last exam, or if they did, you'd state the specific ones, because sometimes and many times those changes can play a role in things like the palpitations that are presented today, or some other cardiac complaint. So I usually follow in with the medications, their medication regimen. And one thing I forgot to mention, before you go present to Dr. Ben-Zur, it's always important that you have the labs open with the patient chart. Once again, this is something you'll understand much more when you are comfortable with the EMR that they use here, the electronic medical record system. But make sure you open up the labs, because he always asks for the labs when you're presenting for a patient. So he'll usually be looking at the labs and reviewing the chart on the computer while you're reporting to him. So yeah, you'll basically present the patient's complaints that day, and other than that, you really just do everything like you normally would do with a patient presentation, and all important facts, make sure you hit on that. And one thing I forgot to mention as well, in patient encounters, is something you always want to ask for their home blood pressures and their home glucose measures, their averages, if they are diabetic, because many times the patients do suffer from white coat hypertension, or their blood pressure is just high in the office due to stress from traffic and things along those lines. So we always like to know what the patient's averages are at home, because they can be a more accurate predictor of the patient's true blood pressure. And also regarding the glucose levels, the blood sugars, we like to know that just to monitor the patient's diabetes, of course. So other than that, Ray, do you have anything that you feel is necessary to add?
So one thing I forgot to mention also, if you notice, we're both wearing scrubs at the moment. So typically, one great thing about this rotation is that they actually don't mind if we wear scrubs. So typically on the first day that you guys come in here, dress up, bring your white coat, just be very professional looking. And afterwards, depending, hopefully for every subsequent rotation, it'll be the same. You get to wear scrubs. So if you guys have scrubs at home, just bring those with you. If you don't have scrubs at home, then you can buy them on Amazon or online, or if you guys are last minute, there's also a couple of stores close by to the clinic itself that sells these scrubs. And that's actually where I got mine as well. So that's something that after that first day, then you can just wear your scrubs, and that's great. Another thing I want to mention is that the staff here is very nice and they're very supportive. So if you guys have questions, if you guys are confused about something, please don't hesitate to ask someone. They're there to help you, and they're there to keep the whole clinic running smoothly. And since now we're part of the clinic staff, we are part of the family, as they like to call it. So they want to support us as much as we want to support and learn from Dr. Ben-Zur.
Going along those lines, Dr. Ben-Zur does a really good job of making this an unbelievable learning environment. He's constantly having doctors come in that he works with to lecture us about various topics from pancreatitis to nephrolithiasis. And those lectures happen about, I would say, 3 to 4 times a week. And other than that, there's constant, educational tidbits that are being told to us constantly throughout the day. For example, if he sees we're doing something or we're in between patients, got an hour or two between patients, he'll have us do ultrasound on each other or, look at EKGs. And there's no real downtime, which I think is a great thing, and I know Ray does too because we've talked about it, because we're constantly it's a busy rotation, definitely, but you're constantly learning something, and you never really feel like you're just wasting your time, which to me is definitely something I wanted from a rotation, to really get the most out of it. And if that's what you want, this is where you got to be, because Dr. Ben-Zur makes it happen. So it's definitely a great time, and you're gonna learn a lot, that's for sure. If you have any questions, you could call up the office anytime. As Ray was saying, the staff here is so nice, and they love having students here. Thank you so much for watching this video, and have a good time rotating with Dr. Ben-Zur.